So is it true that you can get sun damage while driving in your vehicle? Have you seen skin cancer more prone on the left side of the body as opposed to the right side?
Okay, I'm going to tell you more than that. Not only that we can tell that people get skin cancer from driving, I can tell if a person is a driver because usually the driver, their left arm and their left cheek is going to have more sun damage and sun exposure. So yes, people do get a lot of sun damage from driving. It's an excellent question, by the way. And we do encourage people to put on sunscreen, to try to put something, some kind of a protection on their windows in the car if possible. If they do a lot of driving, use some kind of a shirt with a long sleeve and maybe a hat.
Great information. Thank you for confirming that. I wasn't aware of that. Somebody asked, will you please repeat the sunscreen that you showed earlier? So your suggestion for the sunscreen that you
Okay,
like.
the one I showed particularly, it's called Anthelios by La Roche-Posay. Anthelios, Anthelios. Anthelios. And it's just a good, well-made mineral sunscreen. It has both titanium oxide and zinc oxide. So it's a mineral sunscreen. And it's very protective and it's really high quality.
Great, thank you. We've got some more questions coming in. So are tanning beds bad for you if you only use them occasionally?
First of all, let me tell you about tanning beds. I don't think you should want to pay for your sun damage. You can get it for free if you go to the beach. So I don't think tanning beds are all that great. If you're asking, if it's bad for you, well, it's like asking, if I just smoke one cigarette here and there, am I going to get some damage? Well, the answer is yes. It may be slower. It may never actually reach the amount of sun damage that causes skin cancer, but it can be cumulative and it adds to all the other sun exposures. So I really don't think that tanning beds are a good idea. They cost money, they cause the damage. You can get damage for free, and I don't even recommend that.
Okay, great, thank you. Next question. Which sunscreen ingredient did you say to avoid?
Um, avobenzone and oxybenzone. Those are the two that are causing allergies. And then PABA, P as in Peter, A, B as in boy, A, PABA.
Okay, great, thank you. Let's see, next question. Sure, we're reading all of these here. Got some comments, thank you very much, so important. There's another comment question. I've read that being near window inside a house can still give you sun damage. Does that still apply if I lower the blinds to cover direct sunlight access?
If you have no exposure to the sunlight, you're not going to have damage. It's like asking, can you get sun damage in the dark? The answer is no. But if you have some kind of a blind, for example, like the sunscreen blinds, they will tell you how much of the radiation they block out. Some of them block out close to 100%. Those are the ones you want to use to sleep. Some of them block out 70%. That means that 30% of the rays still get through. So if somebody is sitting at a window with the blinds blocking 70% regularly, day after day, over time will definitely cause them to accumulate some sun damage.
Great, thank you. Another question, apologies if I missed this. Do you recommend any vitamins or supplements for skin health? I know that a lot of individuals have read vitamin D helps prevent sun damage and is good for your skin. So do you have any recommendations?
Okay, I think anybody, living in the United States at least, or in the Western Hemisphere, we all have enough vitamins. Most of us have enough vitamins that we do not really have to worry about deficiencies. I know that when you go for a blood test, by the standards of the blood test, it seems like every one of us is deficient in vitamin D. Having said that, if you walk on the street for 5 minutes in normal, not like particularly strong sunlight, your skin will be able to utilize the vitamin D that's converted inside your skin to an active form of it, which we do need, and you do not need to supplement it. In fact, there are some vitamins that when you take too much of them, they can cause damage. And so vitamin D in megadoses is not a great idea. If somebody is truly in doubt, they can go to see a regular doctor, have some blood drawn, and see their vitamin D level. But even so, I would encourage them to be very judicious about the use of really big doses of vitamin D.
All right, thank you for that response. Next question, we've got a lot coming in. Any relationship between psoriasis and malignant melanoma?
No, there's no direct relationship. Psoriasis is a skin condition, it's a rash. It is actually mostly genetic. People who have psoriasis do not have any kind of increased risk for melanoma. However, some people get their psoriasis treated by UV lights. So we have light boxes. Some dermatologists use light boxes. And so what happens is that your skin is now exposed to the same UVA or UVB radiation as you would get from the sun. And even though it can be therapeutic for the psoriasis, it will now expose a patient for increased risk of skin cancer if it's done over time for a long time.
Great, thank you. Next question. So this is kind of specific. So I've noticed sunspots on my arms, 60-year-old male. Is it too late to start putting on sunscreen now to prevent more?
It's never too late. It's never too late. Today is the first day of the rest of your life, and everything you do today is going to serve you for the future. So adding insult to injury by not protecting your skin because you got to be a certain age is not a good idea. It's a great idea to start protecting your skin now. It's a great idea to check those spots on the arms and everywhere else, and to make sure that they're checked every year, at least once, to see that they're not progressing to something either precancerous or cancerous. But it's never too late. It's never too late to stop smoking. It's never too late to start using sunscreen and protecting your skin.
Great recommendations. Another question. You mentioned clothing with SPF protection. Does
Mhm.
that mean that even covering up with regular clothing, you can still get sun damage?
Yes, actually, yes. So if something is not really densely created, some kind of fabric, usually they do let through some of the radiation. So even under clothing, if you go, let's say, to the beach, okay, and you want to put on an Indian, nice light Indian shirt to protect yourself from the sun, well, that light, nice fabric is going to let some of the sun go through. So it's important to put on some sunscreen, even if it's under clothing, because it will be protective. And that's, by the way, another really good question.
Yes, excellent question. This one's another great question. So what should I expect from a spot check appointment?
Well, what you should expect, the dermatologist should give you a gown, ask you to sit down, take a look at your face, look at your ears and behind the ears, look at the scalp, look at the neck from the back to the front, look at the entire body, the trunk, the extremities, the arms and the legs, look between the buttocks, look at the bottom of the feet, because the worst spots are the spots we don't usually look at, and most people don't check their feet regularly. Nobody looks between their buttocks, as far as I know, regularly. So these are spots that a dermatologist should check for you. And if they don't, if you go to a dermatologist for a first appointment and you have some kind of a complaint, say about a rash, and they don't offer you a total body skin exam at least the first time and at least thereafter once a year, you're not really getting the right kind of attention that you should. So that's what you should expect, the total body, thorough look over by somebody who knows what they're looking at.
Thank you for that advice. That's good to know for those who are very curious. And this might be, I'm sure you might recommend that same sunscreen. I did put that in the chat too, the brand and the name. But someone asked, could you recommend a good everyday sunscreen for face and arms? I have very sensitive eyes and they get irritated with some facial lotions.
So this is kind of, difficult question to answer because different people get irritated by different ingredients. And sometimes the base of a cream or a lotion that they put those ingredients can also be irritating. Any kind of an over-the-counter brand, if you go to a CVS or a Walgreens, any over-the-counter sunscreen, mineral sunscreen, is going to be usually free of irritation. But you have to try sometimes a number of different kinds until you get to one that agrees with your skin. Most dermatologists will either carry some kind of brands that they like and they sell them out of their office, or sometimes actually they have their own private labeled products. And usually what that means is that they stand behind that product to be non-irritating, non-allergenic. And if it is, then they usually take it back and then they recommend something instead. So if the over-the-counter products don't work, it's worth asking the dermatologist if they have their own line or if they keep something that they think is really good to use.
That's very good to know. Thank you. Next question, should I be applying sunscreen over my eyelids and ears?
The ears, definitely 100% yes. The eyelids are tricky because the sunscreen can then get into the eyes. But I think it would be really a good idea for anybody to have the kind of sunglasses that have UV protection. It's not very common. It's important not only for the eyelids, but it also protects the eyes. It protects the retina. So instead of putting sunscreen on the eyelids, it's better probably to use some kind of sunglasses that are protective from UV radiation.
Great, thank you. And how do you recommend balancing getting vitamin D from the sun and limiting sun exposure?
You don't need a lot of sun to get enough vitamin D. You don't need to sit in the sun and get a blistering sunburn. You can spend a few minutes walking from your home to your bus or to your car or from the car to where you're going and just spend a few minutes exposed to normal sunlight and you will have enough for what you need for the body to protect itself. So you do not need to get blistering sunburns. You do not need to get too much sun, but you need to get it just a little bit.
Great, thank you. Next question, is getting a tan different or the same as getting a sunburn?
A tan is what you end up with after you get sunburn. So fair-skinned people usually burn first and then it turns brown. And the brown color is usually the skin putting up some melanin. Melanin is the skin's own protection against sun exposure. Some people with darker skin types skip the burning phase and they just put up the melanin and they get darker. But none of this means that they do not accumulate some kind of sun damage while at it. So I really think that, any kind of sun exposure with a burn or without a burn, eventually it's going to lead to sun damage.
Excellent, thank you. This is another question too about foundations with SPF. Do you recommend, is it okay to just use a daily foundation that has SPF or do you recommend using sunscreen additionally to that?
If you have some kind of a foundation that has UVA, UVB protection, and an SPF of 30 in the minimum, but 50 preferably, then it's okay to use a foundation. But usually those foundations are not called sunscreens. And we have some sunscreens, especially the mineral sunscreens, that do have a little bit of a tint to them. So they function as a light sort of foundation just to even out the skin tone. But they do have the high SPF and the broad protection. So the answer is yes, but I think it's better to use the so-called BB creams with a little bit of a tint, the mineral sunscreen in them, and the growth protection.